Yeah. Okay.
Just get back. I'm going to talk to Stiene.
Mhm.
Hey, Caitlin, we're ready to start.
Okay, I'll start now. Good afternoon, everybody. My name's Caitlin Stiene Farisi. I'm an independent insurance advisor. I work for a company called Medicare Resource Group, and I help the members at RSS with all their Medicare questions, insurance issues in regards to Medicare. And I am a resource available to you if you have some questions or need assistance or need to change your plan or just need to review to make sure that you are okay for the following year. There are a lot of changes that are happening to Medicare for next year. Also, we do have some plans that are leaving Bronx County for next year. So we're going to go over the changes. So just so you know, I've helped people, find, help them, find healthcare solutions that are suitable for their financial and healthcare needs. I've helped people get grants. I've helped people get Medicaid, Medicare Savings Program, pharmaceutical assistance programs if a drug is too expensive. I am here as a resource for you, and there is no obligation to enroll in anything, but my services are available to you if you have questions. Okay. So what we're going to discuss today is we're going to discuss the 2024 changes to Medicare, the 2024 Medicare premiums and amounts, the 2024 changes to Medicare Part D, the Inflation Reduction Act, which if you came to this presentation last year, we discussed the Inflation Reduction Act, and we're seeing some changes to Part D for next year. New York's consumer protection laws, which some of you may know. The pros and cons between Medigap and Medicare Advantage, as well as briefly touching on New York Epic, which is a state pharmaceutical assistance program. So this is what people will be paying in 2024. Right now, everyone's paying that is at the standard income bracket. You're paying $164.90 a month for your Medicare Part B premium. It comes out of your Social Security, right? If you're collecting Social Security. Next year, the standard Part B premium will be $174.70 per month, okay? But if you're over these income limits, right? So if you're an individual and your income is above $103,000 or above $206,000 as a married couple, you would have to pay more for your Medicare Part B premium. So if you are above that income threshold, these are what your premiums would be for next year. And not only do you have to pay more for your Part B premium, but you would also have to pay more for your Part D premium called Part D IRMA. Very sneaky. Always people get hit with the increase on their Part B if they're a higher income earner. And then a couple weeks later, they get a little letter that they have to pay more for their Part D. So please be aware, these are the changes for 2024. Okay. So for 2024, and just keep in mind, I know most of you have some type of coverage, but for someone who, and we have people like this who just have traditional Medicare, they don't have anything else with it. This is what you would pay in 2024, right? You would have to pay that $1,632 deductible the minute you're admitted into the hospital, right? Days 61 through 90, you'd have to pay $408 a day. Then after day 90, Medicare gives you something called 60 lifetime reserve days, where you still are paying a lot of money. It's $816 a day. Once you use up those reserve days, you're responsible for all costs. So really, with traditional Medicare, with nothing else, it really only covers you after 90 days. You're essentially, you're paying all costs, right? So it's quite expensive, right? So you do have to get something there to cover those gaps. This is for skilled nursing, right? Days 1 through 20 is a $0 copay, but days 21 through 100, you are responsible for a $204 per day copay. So it is quite expensive if you do not have some type of coverage to fill in those gaps, right? This is just traditional Medicare with nothing else. These are the 2024 numbers. This is what Part B is. So for next year, the Part B deductible is going to be $240. This year, it's $226. Next year, it will be $240. And what that means is you must reach that deductible first before your Part B insurance starts paying 80%. Okay. With Medicare by itself, there is no cap on your out-of-pocket exposure. So let me give you an example, and I've had this happen to people. If you are doing, let's say, outpatient chemotherapy, right? And let's say you're doing 12 treatments, and your chemotherapy Medicare amount is $100,000, you, the patient, are responsible for $20,000. There is no, oh, you spent X amount of dollars, we'll now pay the rest of your medical expenses for the remainder of the year. Traditional Medicare does not cap your out-of-pocket exposure. Okay, so. Okay. So obviously, as many of you know, so because of that, people may get something called the Medigap policy, right? Your Medicare Part A and B stays intact, the red, white, and blue card. You could go to any doctor in the nation that takes Medicare, right? And approximately 96% of providers nationwide accept Medicare, according to a Kaiser study, okay? So you tend to have predictable out-of-pocket expenses, which is nice, and your doctor has more flexibility in managing your health care. You have to show 3 cards. So that's always the case. You have to show 3 cards, your red, white, and blue card, the Medigap card, and then you have a drug plan card that you use at the pharmacy. This is the a la carte way to get your Medicare. The doctor bills Medicare, and then the balance gets sent to your supplement plan, also known as a Medigap plan, okay? So these are the Medigap plans, right? And this shows you, so we were talking about in the earlier slides, some of the costs you would pay for hospital, right? And these supplement plans are all standardized, so it doesn't matter what company you go to, they will be the same, right? A plan N is exactly the same, whether it's Aetna or Blue Cross Blue Shield, but what will vary are the premiums, okay? So you could see some plans, okay, when you're looking at this, it's probably confusing some of you, but when you look at this, you have to look at it as the Medicare costs, right? So what did we say for hospital? Hospital has, it's over a $1,600 deductible. Well, these are the plans that would pay 100% of it. These are the plans that would only pay partial, right? So you have to look at this as when you're looking at the Medicare costs for things, right? So these are the supplement plans. The most common ones are Medigap Plan N and Medigap Plan G. Just so you know, I use Medigap, Medicare supplement. It's the same thing, but I use both terms. It's the same thing, just so you know, okay? So these are the standardized Medigap plans. So one thing to know about New York State is we have excellent consumer protection laws. So what does that mean? First being that we are a Medicare overcharge measure state known as a MOM state. And what that means is if you go to a provider who takes Medicare, but they don't accept Medicare assignment, the provider is allowed to bill a 5% excess charge. In most states, it's a 15% excess charge. So you are protected where providers cannot overbill you these exorbitant amounts, okay? New York is also one of the very few states in the country that is a guarantee issue state for Medicare supplement plans. That means that regardless of your age or your health status, a Medicare beneficiary can sign up for one of these policies without any health questions asked. That is not true for most states. So most states do something called medical underwriting, right, when it comes to these kinds of policies. So people who become new to Medicare, right, specifically Medicare Parts A and B, you have a 6-month window to get a Medigap or Medicare supplement policy without any health questions asked, right? Once you're out of that window, if you're not a healthy individual, you cannot purchase one. That is not true in New York State. We do not do that, okay? So the only limitation in New York State is that you could incur a waiting period for a pre-existing condition. However, if you did not have any lapse in your coverage, the waiting period is waived. So this is how the waiting period works. So if you're on a Medicare Advantage plan and you need to switch to a Medigap plan, the waiting period is waived, okay? If you decide to change your Medicare supplement plan to another plan, right, maybe because it's a cheaper premium or whatever the case, the waiting period is waived. If you're on a retiree plan, maybe you're on GHI senior care with the city or something like that, or whatever the case, and it's COBRA, and you need to get a Medigap policy, the waiting period is waived. But if you just have traditional Medicare only, right, or even with a drug plan, and you want to get a Medigap policy because now your house is on fire, you just got diagnosed with something, the waiting period will be enforced, okay? And this information you can find at dfs.ny.gov, okay? So Medicare supplement policies are state regulated. So when you go to the general Medicare website, you've probably may have seen, I have an 6-month open enrollment period for a Medigap policy. That's general because that's true for most states. But New York is very unique, and this information is found on the dfs.ny.gov website. So New York State oversees Medigap policies, and these are all our laws, okay? Really good consumer protection laws here. So these are some of the cons, unfortunately. So since we are a guaranteed issue state, our premiums are definitely higher than states that do medical underwriting. So you can expect to pay on average in New York between your Medicare Part B premium, right, your Medigap premium, and a drug plan premium, on average, at least $400 a month. So another con is Medicare supplement plans, also known as Medigap, do not offer any ancillary benefits such as dental, vision, or hearing. So if you want extra benefits such as dental, vision, or hearing, you need to purchase a separate policy, resulting in additional premiums. These premiums can increase each and every year. So this in turn over time can make these policies very expensive for someone who is on a very fixed income, okay? So are there any questions on that? Does anyone want me to, any questions in the chat box? Anything that maybe you didn't understand? I'm happy to go over that with you.
Anybody have any questions or comments yet? Well, I'm checking out here.
Yes, I
only-
do.
Okay, sure.
My comment is that if it's being recorded, it would be helpful that we can view it again.
The way it works is it will be recorded and then we put it up on our YouTube site and people will get a link to the YouTube site.
Thank you very much.
Okay.
My question is Medicare supplement and Medicare. You're using those two phrases. Are they the same thing?
It's the same thing.
Okay, thank
They
you.
are. Yeah, I highlighted that at Medigap, Medicare supplement. It's the same thing. It's just two different names for it. So they call it Medigap because it's there to fill in the gaps. The 20% that Medicare Part B does not cover, the hospital deductibles, the addition, the co-insurance. They call it Medigap, but they also call it Medicare supplement. It's
Great, thank
technically,
you.
it's just there to follow Medicare. You're welcome. Yep. Now
Okay,
let's talk about Medicare Advantage. So
Sorry,
yeah.
Caitlin, real quick, someone was asking for you to repeat that DFS or that what you were just talking about. That organization?
The website.
Oh, yeah, the website.
Well, the organization, this is New York State Department of Financial Services. So you can look it up. You can look up the laws in New York. A lot of people do not know these laws. I've been doing this a long time, and it's a great protection law that seniors have. So it's on dfs.ny.gov. Okay. So you cannot have a 63-day lapse in coverage. So very important to know that. Okay. So we talk this again.
Oh, I have actually, if you are in the center, I have her business cards. So I will be giving out Caitlin Steene's information. Again, it is a free service. She will service you one-on-one and she's amazing. She has a very good reputation.
Okay. Thank you.
I'm praising you, Caitlin.
Thank you. So yes, this is can be found on dfs.ny.gov. You will not find this information on the general Medicare website because Medicare's federal. These plans are regulated by the State Department of Insurance. Okay. Okay, we talked about the cons of a Medigap plan, also known as Medicare supplement. I use them interchangeably. Okay, so let's talk about Medicare Advantage. not everyone can afford a Medicare supplement policy. They can't, unfortunately, they are very expensive here. And we have seniors that are on a very limited income. Okay. So Medicare Advantage, you are still part of the Medicare program, right? But now you have a private insurance company managing your Medicare, right? The doctor sends the bill to the private insurance company. They don't send it to Medicare. So in the prior slides, when I was talking about Medicare, also known as Medicare supplement plans, in that scenario, the doctor sends the bill to Medicare and then Medicare sends the balance to the supplement. But on a Medicare Advantage plan, the doctor sends the bill claim to the Medicare Advantage plan. The private insurance company is in control of your health care, okay? Typically, you use one card for everything, right? Because most Medicare Advantage plans will have the drug coverage built in, right? Typically, a Medicare Advantage plan will have a very low premium to a $0 premium. And how you are protected is you have something called a maximum out of pocket. A lot of people call this a deductible. It is not the right term. What a deductible means is that the insurance company would not cover you for something until you meet a dollar amount. So let's say I have a deductible of $100, right? I'd have to pay that first before the insurance company covers me. A maximum out of pocket is not a deductible. It is your financial safety net, right? What it means is every time you pay a copay for something, every time it gets accounted for. The insurance company is like an accountant. They keep track of your out-of-pocket expenses for the calendar year. Can someone mute themselves? I hear. Okay. I hear. It's kind of distracting. Is it the? Let me just see. Okay.
Everyone's muted.
All right. So. Okay. I think it was the RSS center that's okay. So if someone hits their maximum out of pocket, then the plan would pay 100% of your medical expenses for the remainder of the calendar year. Okay. The maximum out of pocket restarts again every calendar year. Okay. The study done said about 2% of beneficiaries in the country hit the maximum out of pocket each year. So there's 98% that don't, but there are some cons with Medicare Advantage. So the pros are you can get dental, vision, and hearing. You get some of them give you very nice extra benefits, but there are copays. You have copay responsibility. So this is not a plan that exists, but you can expect in this area, the copays to be in this price point, in this area in the Bronx. So this is just to show you what a Medicare Advantage plan looks like. It looks a lot like employer insurance if you were working, right? Everything has a copay, right? So if I pay, this is an HMO, for example, I can't go out of the network on this plan, but let's say I pay $40 for my specialist, that gets accounted for towards my maximum out of pocket. And if I reach that maximum out of pocket, then the plan pays the rest of my medical expenses for the remainder of the calendar year, right? Now in Bronx County, there are plans that have a maximum out of pocket of $8,850 or lower. This is just a sample. This is not an actual plan, but it's just to give you an idea of how these plans operate, right? So you pay as you go. That's basically what happens, right? You pay as you go for everything. So typically, you have a copay for hospitalization for the first 5 or 6 days. And if you're in there for 6 months consecutively, as long as, everything you're doing is covered and it's approved, right? The copay responsibility that comes out of your pocket, it should only be for the first 5 or 6 days or whatever it is that is specified in your Advantage plan's summary of benefits. I see I have a chat question. So the question is, okay. So someone just asked, I have Part A and a federal retiree plan. What counts to allow? So typically with Medicare Part B, so folks know, if you have to be actively working for a company with 20 or more employees, you can delay your enrollment into Medicare Part B. If you're no longer actively working, if you sign up for Medicare Part B, you will incur a penalty, 10% penalty for each 12-month period you did not enroll. So you would pay, let's say you don't sign up for 3 years, you have to pay a 30% penalty on top of your Medicare Part B premium. Okay. And you pay that for life. So I hope that answered the question. Okay. So back to Medicare Advantage plans. This is basically what they look like. You pay as you go, right? Everything gets accounted for. Okay, some give a gym membership, dental, right? You still have to pay your Part B premium, but you're paying less on the front end, okay? Now this, let me just, screen froze there for a minute. This is what an Advantage plan that's a PPO would look like. So a preferred provider organization means that you have in-network coverage and you have out-of-network coverage. However, you will pay higher copays when you go out-of-network, right? So typically, when you're on a PPO, right, you tend to not need referrals, but if you go out of the network, you are going to have higher copays, higher coinsurance, and you are going to have a higher maximum out of pocket, right? And the numbers coincide. This is what you would see in Bronx County. Some are lower, right? So let's say you're in network and you hit this maximum out of pocket, and now you want to go to some hospital that's not in the network. Let's say you would have a couple more $1,000 you would need to meet before you would hit the maximum out of pocket. Okay. But these are the most common Advantage plans you will see that have this kind of benefit structure in Bronx County. Okay. So again, if you reach that maximum out of pocket, then the plan pays 100% of your medical expenses for the remainder of the calendar year, right? Pay as you go. You do have to use a network, right? So let's talk about some of the cons with Medicare Advantage. So these are the cons. Usually you do have to use a network of providers. On a traditional HMO, which means health maintenance organization, you can only go out of the network in an emergency if you are outside the service area. You have to remain in the network in order to receive medical services. So typically you do have network limitations. Even a Medicare Advantage plan that is a PPO, which means preferred provider organization, easy way to remember is they prefer that you stay in the network, but you do have the option to go out of the network. It is still up to that provider if he or she wants to accept you as out of network, right? What a lot of people don't know is that it's up to them. And what you may deal with is some doctors don't want to deal with directly billing. So they may say to you, you have to pay us up front, and then we'll give you an itemized receipt, and you have to submit it to the insurance company for reimbursement, right? Because you pay as you go, in the event your health does change, your out-of-pocket costs can start to add up, and it can become expensive if you're seeing several providers a month, right? And let's say on your Advantage plan, it's a $40 copay to see the specialist. That can become very expensive, right? So give you an example, on pretty much most Advantage plans in Bronx County, outpatient cancer treatments and dialysis typically is going to cost 20% coinsurance on your end on most Medicare Advantage plans. In this scenario, the individual most likely will hit their maximum out of pocket. This can be costly as well for someone who is on a fixed income. So even though you are protected on a Medicare Advantage plan, you do have something called a maximum out of pocket that protects you financially, right? If you're on a tight income and you have a rough year, hitting that maximum out of pocket can be very stressful. And I'll give you an example. I have a client. She is too over the income limit for Medicaid, cannot afford a Medigap plan. Okay, she's on an Advantage plan that has a $7,550 maximum out of pocket. She was diagnosed with cancer. Okay, now I know her income, and I know that would struggle to pay for the cost sharing on her end for her treatments. So we had to get her approved for a grant, a cancer grant of $10,000 in order to cover her 20%. So, you know, there are cons to this, right? And the con is also that if you hit that maximum out of pocket, right, it's going to restart it come January 1. So there are attractive features, but there's also cons to this. This may not work for someone who has a lot of health problems. Okay. And unfortunately, New York does not have, and other states have it, something called an indemnity plan for people who are Medicare age. where they're in other states, they have these little plans that can pick up some of the high copays on Medicare Advantage plans. We don't have them, but I do have good news that finally next year in 2024, New York is finally going to get a hospital indemnity plan that is specifically designed to pick up some of the high copays on Medicare Advantage plans. We are finally getting one. I've been fighting with the Department of Insurance for years, saying that we desperately need them because there are some high, we have some high maximum out of pockets here due to the fact the cost of living is very high. So that might be a game changer for some people. They're not that expensive, but when they do come out next year, I'll let people know. I think they're still in the process of getting approved by the Department of Insurance. So that might be very helpful for some people. I want you guys to be aware that right now we're in the annual election period that runs every year from October 15th to December 7th. Unfortunately, there's a lot of unscrupulous marketing tactics occurring. Many of you probably know this. You probably get 10 to 12 calls a day talking about your Medicare. You probably get mailers like this that look like it's coming from the government. It's not. This is a solicitation for a Medicare Advantage plan. Okay. They make it look like it's a government document or like an entitlement. And when you call the number, it sounds like it's like a government entity. It's very misleading. It's not compliant whatsoever. Okay, it's a marketing piece for Medicare Advantage. There are plans out there that do reduce the Part B premium a little bit, but be aware that when they're reducing, if they're giving you a benefit, they might be taking away other benefits. There could be usually network restriction, higher copays. So be aware this is a marketing tactic. This is not a government entitlement. If you're on an employer retiree plan, like with a union or something, and you sign up for something like this, it is going to screw up your coverage. So please be very aware. If you get mailers like this, you can report them to Medicare, to 1-800-Medicare, because they are trying to put a stop to this, okay? So please be aware. One of my clients gave this to me, and she thought it was a government entitlement. And I said, no, it's not a government entitlement. Okay. So really it comes down to two options, right? So some people cannot afford Medigap, right? They cannot afford the premiums. Okay. You have really two options when it comes down to it. If you're on a retiree plan with the city, or you have some type of employer benefit, the decision has been made for you. You typically do not need to look into the individual market, but for people that don't have that benefit, they have to look into the individual market. And these are your two options, right? So we talked about this option, original Medicare with a Medicare supplement plan, also known as Medigap. It's the same thing, and a standalone drug plan, right? You could go to any doctor in the country that takes Medicare. Your doctor has more flexibility over your healthcare. You tend to have very predictable out-of-pocket costs, but you are paying more on the front end. You're paying more in your premiums, okay? Or Medicare Advantage, where you tend to not pay much on the front end, very low premiums, but you will pay when you use it. You have co-pays, okay? So let's talk about Part B. So there has been a lot of changes that I have seen for next year. So for example, the Inflation Reduction Act was passed, and we're going to see even more changes in 2025. So what that law stipulated was that if the rate of prescription drugs goes up higher than the rate of inflation, the pharmaceutical companies have to pay a rebate to the federal government. That's number one. Number two, the government is now going to start negotiating prescription costs. These are all good things. However, what I am seeing, especially for people that are on standalone drug plans, these are people who are not on Medicare Advantage, people who are on standalone drug plans, I'm seeing large increases in premium. I'm seeing copay increases for prescription drugs. So please be aware that there are some changes happening, and you really need to make sure that your drug coverage is suitable for next year. So this is the standard phase. What that means is Medicare dictates a blueprint, and all the companies have to follow this blueprint, right? Things are going to vary, but this is their blueprint. So for example, you will not see a plan that has an $800 deductible for prescription drugs. It will either be a $545 deductible or less, right? And typically you have to meet that deductible if your plan has one for brand name medications, specialty medications. Typically your generics are usually going to be inexpensive and not have a deductible, okay? So it's the amount you owe before the insurance carrier would help you. Okay, that's what a deductible is, right? The initial coverage level. This dollar amount right here is standard for every standalone Part D plan and Medicare Advantage prescription drug plan in the country, in the individual market. That dollar amount is exactly the same, does not matter. So what that means is that dollar amount of $5,030 between my share and the plan share, right? Once the costs combined exceed $5,030, I now fall into what's known as the coverage gap, which about 10% of beneficiaries each year fall into that. Not a fun place to be, because what you probably notice is come June, July, all of a sudden your copays at the pharmacy are way more than what they were the month prior. Okay, so if you fall into the coverage gap, you then have to pay 25% cost share for your prescriptions. So let's talk about catastrophic. So this is new. And this is what the Inflation Reduction Act did that I want to just briefly go over. Okay. So in the past, if you fell into the catastrophic phase, right, you somehow you got out of the donut hole and you now entered this phase, you used to have to pay 5% coinsurance for your prescriptions if you were in that phase, or a low copay for your prescriptions. Now they got rid of that. If you fall into this phase, you have no copays at all. They 100% pay all your prescription costs. So that changed, okay? So it says until your true out-of-pocket costs reach $8,000, then you fall into the catastrophic phase. Your actual drug copay should be capped at about $3,300 for the year through all the phases. For 2025, we're going to see it capped at $2,000. That's what they're saying. So they're projecting for 2025, you as the beneficiary, you will be capped at $2,000 in prescription costs. And then if you hit that amount, then the drug plan pays 100% of your medical expenses. We don't know how that's going to impact the plans for 2025. This is this is the start of the Inflation Reduction Act being enforced, but it's really going to come into full force in 2025. I don't know how it's going to impact the drug plans. We will have to definitely do this again next year to see what those changes are. But this is the standard benefit phase that all the drug plans have to follow. But what will be different is every plan covers drugs differently, right? The copays can vary from plan to plan. For instance, Eliquis, that's a very expensive drug. That's going to vary dramatically from plan to plan. Some companies may not even cover the prescription, right? So it's very important to know that your prescriptions economically work with that plan, because every drug plan operates differently. Although Medicare dictates they have to cover 2 prescription drugs per therapeutic category, they don't dictate how they're supposed to cover them, right? So the cost of those prescriptions can vary from company to company. And also it can vary with the pharmacies that you use. So this is important to know. You want to make sure the pharmacy you are using is a preferred pharmacy with the insurance company, okay? Typically, as you know, SilverScript, which is Aetna, CVS is a big preferred. United Healthcare, I think it's Walgreens, right? So these are important things to know. More and more, unfortunately, the mom and pop pharmacies, each and every year I'm seeing it, there's less and less of them around, and it's a shame. But unfortunately, these large conglomerates are able to offer these discounts that a lot of these pharmacies cannot compete with. So, just be aware, make sure you're using the right pharmacies and that your drug plan is, your meds are working with that drug plan. Okay. Are there any questions on this? Okay, so they say your drug copay should be capped at about $3,300. That's what they project it to be. We'll see how this all goes into effect in 2024. But I know some of you are probably getting notices about your drug plans going up in premium, because I've been getting a lot of calls about it. So make sure you're all set up right for next year. So let's talk about New York Epic. So it's a great program that New York State has, and a lot of people don't know about it. I'm sure a lot of you know about it, because RSS definitely has talked about this quite a few times. It's a state pharmaceutical assistance program, and it works in conjunction with the Part D, okay? Let's see, I have another question in the chat box. If your drug plan has been discontinued in the Bronx, then you need to enroll in a new plan for the new calendar year. So typically what happens is if the drug plan's leaving, you have till 12/31/2023 to make a change because your situation is different. So whenever a plan's leaving, you guys can make a change beyond December 7th, right? If your plan's not leaving and you just want to change, you're only going to have till December 7th, from October 15th to December 7th. Okay. So if your drug plan is leaving, then you need to make sure you are enrolled into a new drug plan for January 1st. Okay. So the New York State EPIC program is a really, really good program. It works in conjunction with Medicare Part D. Okay, it is not a drug plan, but it works in conjunction. Okay, so many seniors qualify for this program. So if you're age 65 and over, if your income is $75,000 or less, if you're single, or $100,000 or less, if you're married, you qualify for EPIC. Okay, and it can help you if you fall into what's known as the coverage gap. It can potentially help you with your copays. But what's really good about New York EPIC is it allows people a one-time special election period that can be used once a year at any time to make a change to your Part D plan or your Medicare Advantage Part D drug plan. So let's say we're in April, right? There's no election periods. You're in your plan and your doctor prescribes you a new medication. And that medication it is not compatible with your plan. It's expensive. But you see there maybe is a plan that has it for a lot cheaper. Well, you have EPIC. You can use it as a special election, as a qualifying election period to get out of your insurance and switch to another plan. Let me give you another example of why you would want to have EPIC, right? If you're someone who's on Medicare Advantage, right? And there are benefits to Medicare Advantage, but let's say you get a diagnosis such as cancer and you're going to be doing a lot of treatments. You're going to be having ongoing medical issues. That's going to be requiring a lot of follow-up care, and you're concerned about the copays. Well, you have New York EPIC. You can make a plan change outside the enrollment periods. You enroll yourself into a standalone Part D drug plan. You sign up for your Medigap plan, and consecutively, that would take effect the first of the following month. No waiting periods, because again, as long as you're making a change consecutively from an Advantage plan to a Medigap plan, New York's laws, the waiting period is waived. Okay, so these are some ways that these laws benefit you as a consumer. Okay, so let's just talk about EPIC briefly of what the requirements are, or the categories. I'm sorry. So most of you fall under the deductible plan. So what that means is this is not a mandatory payment. So a lot of people, if you get the EPIC brochure, they always get freaked out when they see the numbers because they think they have to pay this to EPIC, and you don't. Just what it means is, let's say my income is at $28,000, right? And let's say I have an $840 deductible I need to reach with EPIC. Well, if I'm only just taking a statin, right, I'm never going to reach that deductible. I'm never going to reach it because my drugs aren't expensive. But let's say I'm on biologicals, right, or really expensive medications. And let's say my drug plan has a $200 deductible. I would first have to reach the deductible with my drug plan. Then all my co-payments moving forward would get counted towards the EPIC deductible. Once I reach my EPIC deductible, the most that I'm paying for my medications is $20. I have a woman that's on an infusion, a home infusion that falls under Part D, and it's a very expensive medication. She reaches her EPIC deductible, I think, within 1 month, and after that, she's paying $20 for that medication. So it can be very helpful for people that are on expensive prescriptions. Now, this is the fee plan, which I always found kind of counterintuitive. So if you tend to fall, if you're under 20,000 or under 26,000 as a married couple, you have to pay a yearly fee to EPIC. So for those individuals, if you fall in that income bracket, then it may make sense for you to get EPIC when you absolutely need it. Okay, but most people fall under the deductible plan. Very easy application to fill out. Within a week or two, you get a purple card. I think it's like a purplish card, and you give it to your pharmacist. They put it into the system one time, and that's it. And you just keep it there in the event something does change. Again, maybe you get prescribed an expensive medication. Maybe you need to make a change to your plan. These are just some important things to know in the event something does change, because as you age on Medicare, your needs will change. And statistically, another study has shown people from 65 to 75 on average don't utilize their Medicare that much. It's 75 into your 80s and 90s is when people start to utilize their insurance a lot more. So again, things do change. And what works for you now may not work for you in the future. So definitely important to know that. So again, if anyone has questions, this is my contact info. Selena has my cards in her office. So if your plan is leaving, we do have some plans leaving Bronx County for next year. I know Elixir, the drug plan, is leaving. We have the Emblem VIP Reserve leaving Bronx County. We have the Empire plans. I think it's the Empire Meta Blue Select that is leaving, the Empire Meta Blue Health Plus that is leaving, the Empire Meta Blue Extra Select that is leaving, and the Empire Meta Blue Health Plus Select. Those plans are leaving Bronx County for next year. If your plan is leaving, you will have till December 31st to make a plan change. The rest of you will have till December 7th, okay? So if anyone has questions or has to make a change, feel free to reach out to me. Again, there is no obligation to enroll into anything. What I do is I look at your meds, I look at your situation, and we sit there and we will find whatever plan is most economical and suitable for your needs. Okay?
Caitlin, you're also gonna be in the office a few days, right?
Correct. So these are the dates that I'm going to be at RSS. If anyone wants to come in and wants me to take a look, I will be in on Thursday, November 2nd from 10 a.m. to 3 p.m. November 16th, 10 a.m. to 3 p.m. and the 30th of November, 10 a.m. to 3 p.m. I think the week before that is Thanksgiving. So, I don't think anyone wants to look at their drug plan or Advantage plan on Thanksgiving, but these are the days I'll be in if anyone has questions or has to change something. Are there any questions with what we went over? Is there anything you guys want me to touch on again? Because I know, this Medicare stuff is quite confusing for people. Okay. Yes, if he still has the Epic card from 2018, it should still be viable. Yes. Hi B, how you doing? I know you. Yes, it still should be viable. Anybody else have a question?
Anybody have any questions in the center? Okay, yes, I'm just
Yes.
gonna bring the microphone, hold on for 1 second. Okay.
Yes, I have a question at home. On
Right,
Zoom.
hold on, we're gonna do. Can we do the center first?
Yeah, we're gonna do the center.
Okay.
The center, and then we'll answer any questions that for the people online. So just hold off on your questions online.
What's the best way to deal with all of the many phone calls we get? Hang up. Obviously, they're looking for our Medicare numbers, so we don't want to give them out. But what's the best way to get rid of them?
So you can
hang up?
scare them. So I'll tell you a couple of things. Right now, I'm in a group of agents that are trying to stop this because there is bad actors, unfortunately, in any profession, and I really dislike the bad actors that give us, one's a bad name. So the FCC is trying to, I think it's the FCC, they're trying to stop this. You can go on the do not call registry, but it doesn't help a lot. But they are starting to implement hefty fines on these telemarketers. But what you can do when they call, because they don't know, if you use insurance verbiage, it will scare them, and it will stop a lot of the calls. If you say, I would like your national producer number, what is your NPN? That agent is required to give you their NPN. Guarantee you they will hang up. Okay, so that's one way you can do it. If they do give you the NPN number, then I would report them to Medicare. So you can call up 1-800-Medicare and report these issues. They are fully aware of it. The do not call registry, you can, if you're on the do not call registry and it's unsolicited phone calls, you could potentially get them fined. I think you can submit a report. I think it is the FCC. We will do a presentation on how to do this, but they are starting to crack down. So if it's unsolicited, they are starting to fine these call centers who are soliciting people who are on the do not call registry. So yeah, that's one way, just if you use that verbiage, what's your NPN number? A lot of the time they'll put it in their system that, do not call, right? Because what happens is you may have filled something out years ago, who knows, right? and it gets filtered through these third-party marketing organizations. So they call them aged leads. That's what they're called. And you probably are circulating around, through these third-party vendors who sell your data to other companies. So that's a way to kind of put a stop to it. Another question?
I have been on the do not call list. I found out this week since 2005, and I still get literally 20 calls a day.
Yeah.
How do we inform the FCC if they don't give us an NPN and they just hang up, how do we inform them?
Right. So there's a website that you can report the calls. I'll send it to Margie. There is a website where you can report it. Unfortunately, I mean, it's stopping. I've noticed I've gotten less spam calls. I mean, it's still happening, but they are trying to put a stop to it. So, I would just document every time you get a phone call. Unfortunately, they use spoof numbers, so it is a little difficult to trace. But I would just keep dates, and a track of the phone numbers. And I would, you can report it to Medicare. They are taking complaints in regards to this. But, unfortunately, it is difficult to fully stop. I mean, a lot of people have gotten rid of their home number because the calls were so overwhelming. I do think with your cell phone, you have a little bit more control, but it is, unfortunately, there's no foolproof solution.
Hey, Caitlin, I'm going to move us on to a couple of questions. Let me just see, is there anyone, I see some questions in the chat, but is there anyone who's online who wants to just ask a question, to unmute themselves and ask a question? Anybody?
Yes, I have two questions. If we're happy with our existing plans, we don't need to do anything, right?
Yeah, if you're happy, you don't need to change. As long as, you got the annual notice of changes and everything looks fine and you're pleased with those changes, you can stay right where you are as long as the plan isn't leaving. Yeah. Mm-hmm.
Okay, and the other question is if our plans right now don't include a dental, can we add on a dental plan?
Yeah, you can. You can add on something called the standalone dental plan. Mm-hmm. You can do that.
Are those, do you recommend any of those, or is it worth it?
Yeah, it's worth. Some of them are. I would take a look at Physicians Mutual. I just bought them for myself. They have no annual limit on the. They're new. They have a new options for Bronx County and New York. So I would take a look at them, because a lot of the plans only have like a $1,500 limit or $1,000 dental limit, and you're paying like $25 to $70 a month for the insurance. So they are relatively they have some new products in this area that look pretty good for next year. I actually bought myself one because it didn't have a limit on my out-of-pocket costs. So Physicians Mutual I would take a look at. I think Delta, Cigna, there's some decent options here. Mm-hmm.
And
Any other questions?
I just sort of another one. If we're living in two places because we go to Florida in the winter, which plans, like right now we have United Healthcare, before that we had no, and they both cover doctors in Florida and New York.
Mm-hmm. Yeah, so typically, I mean, there are some plans, yeah, so some plans have a national network, some don't. So typically the major United, Aetna, Cigna, Humana, those are the four that tend to have national networks. The more local based companies do not. So Blue Cross does not, Emblem does not, neither does Health First, only under certain circumstances, obviously an emergency. So it depends on the company. Mm-hmm. Yeah.
Okay, so let me go to a couple of questions that are online. Because I think some of them are also very personal to whatever someone's circumstances, and that will be a great reason to touch base with Caitlin. One question is, what is Oak Street Health? Someone's having trouble finding a PCP with a PPO health plan.
Yeah, Oak Street is it's a medical group. They have they're a group of physicians, no different really than like Montefiore. It's a medical group, and they have a value-based contract with certain companies where you may not be able to use them as a PCP on certain plans. So, it's some plans do have that. That's something called a value-based contract, where certain medical providers will only have a select amount of value-based contracts with maybe one insurance company or two insurance companies, and then they can't act as a primary on other plans. That's common. I've seen that. That's something called value-based care. So that's becoming more common. I am seeing some more of that. So the Oak Street Health is a medical system of doctors. Mhm.
And then the last question we have sort of on the online side is to change from a federal plan, what policy changes qualify you to change without a 10% penalty?
Yeah, so again, if she is actively working and you're losing you're going to be retiring, that gives you a special election window to sign up for Part B without any penalties. But if you've been, if you stopped working, right?
Yeah.
And you've all these years, you've just had Part A with a federal plan, you're going to get a penalty if you sign up for Part B. So, you may want to look at your federal coverage in certain circumstances. If the federal plan is providing you with medical outpatient benefits in coordination to Part A, if it suffices and it's adequate with what Medicare Part B provides, maybe you may not be in your best interest to take on Part B if the federal plan is doing its job. If you're working right now and you're going to be retiring, you can sign up for your Part B. You have 2 months, typically do it 2 months before your retirement date. You would send out an L564 form and a CMS 40B form to Social Security. The L564 form is your employer attesting to the fact that you've had creditable coverage from 65 onward.
Oh,
Any other questions?
I'll contact you.
Selena, any other questions in the center?
Plenty of questions here. So, okay, so.
Yes, if you sign up for a Medicare Advantage plan, and then you find out you don't like it, and you go back to original Medicare? And another question, if your physician goes out of your Medicare Advantage group, could you switch to a PPO at that time and to cover him?
So if there's if let's say you're in no election periods and that happens, no. So, but only from October, if you're on Medicare Advantage from October 15th to December 7th, you can make a plan change. From January to March 31st, you can also make a plan change. So if it happens in those windows, yeah, you could. But if you have New York Epic, right, and something happens at some point throughout the year, you could use your Epic to get out of that Advantage plan and enroll into another plan that does have that doctor in the network. So,
Okay.
yeah.
Okay.
And you could return back to traditional Medicare, yes.
Okay. Yeah.
Caitlin, I belong to Emblem and I got a notice that they're closing their plan, they're ending it. And they
Is that Deborah?
Yeah. Yes. it's
Deborah, I've been trying to reach you. Yes, they're leaving.
Any-
We have to meet.
Yes, do, because they're talking about getting into original Medicare if I want. I don't know what that means.
Well, we'll talk about that. We'll talk about your options. So, I'm gonna give you a call and we'll set up a date to meet up. Does that sound good?
Thank you, thank you.
Yeah, so I told Selena to reach out to you. We'll talk. Okay. Anybody else?
Yes.
I wasn't here when you said that we could contact when the folks call us to solicit to call a MPM number. What is MPM?
Oh,
What's
NPN means, so ask for their national producer number. So I'm just gonna go back.
Their number.
With NPM.
Oh,
So
correct.
you guys see right here, this is my NPN number and my license. That's my license with the Department of Insurance. And the people who are calling, believe me, they have licenses, but what they're doing is not ethical at all. If you use insurance verbiage, like I want your NPN, national producer number, start using those terms, they're gonna get nervous. They're gonna think maybe you're a secret shopper, which is basically people that are employed by Medicare who try to pretend to be a consumer to see what's going on with these unethical practices. You'll scare them, and the more you do that, I could tell you, you'll be updated in their little system as do not call this person, potentially a threat, whatever the case. It'll stop some of the calls. Is it going to stop it all entirely? No. I mean, you can go on the do not call registry. It helps. It doesn't stop it. We are trying to put a stop to this. And I am going to do a presentation on this because there is a method, there is a process that they're starting to make seniors, report this in a better way. and to start implementing serious fines on these actions. So we'll definitely do something about, we'll do a presentation on it, how to stop these calls. 'Cause it's going to require a group effort to really put a stop to this. Any other questions?
This is the elephant in the room, and somebody had asked this. New York City retirees. Is there any updates of what's going on with the Medicare Advantage plans? Do you know of any?
So as of now, I do follow the page. I talk to the retirees who are fighting in the courts with this. As of now, everything is still up in the air. So, you know, that you are not being rolled into that Aetna PPO plan. But, you know, of course, this is still going back and forth with the courts. The decision has not been officially finalized. What retirees are proposing for Aetna to do is they want there to be two options for retirees, either an Advantage plan and a Medigap plan option. So that's what they're proposing. I'm very confident due to the fact the retirees have won the case a few times already. I have faith that whatever is the end result is going to work in your favor as a city retiree. And I think I told Selena, I'm no longer consulting with city retirees at this point in time due to the fact there's so much uncertainty. Until the decision is officially and definitively finalized by the judge, then we can definitely, if you want to consult with me, that's fine. But right now there's so much up in the air. I don't want to give you incorrect info due to the fact these plans on the individual market change every year. They can change. So any other questions?
Oh, okay, hold on. Yes.
Yes, I'm not a city employee, but I'm wondering why they have so much opposition to joining a Medicare Advantage plan if there's so many advantages to that choice. Why? What would it be their particular objection from joining that?
So with the Medicare Advantage plan, you got to understand the private insurance company is in control of essentially managing your Medicare benefit with certain more so with elective related procedures. They can, you know, so for example, there's something called Part B step therapy, right? Step therapy, meaning that let's say you need a knee replacement, right? And you're on a Medicare Advantage plan and the doctor wants you to do a knee replacement. The company may say, well, we would like him to do physical therapy first before we decide to approve a knee replacement surgery. So those are some of the caveats that people do not like with Medicare Advantage. However, there are laws that are being passed and there are going to be changes that we're going to continue seeing with Medicare Advantage, where I believe as the years go on, Medicare Advantage is going to act and behave more like Medicare. So for example, Medicare is really keeping an eye on the amount of claims and denials in between all the insurance companies. So what they propose in the near future is that if an Advantage plan denies care, that the same way, where it's something that traditional Medicare would approve, they could potentially, deal with some type of repercussion. So, not all Advantage plans are created equal. I would say about 10 years ago, there were a lot of, HMOs, maybe the networks were smaller. There were some problems. Medicare Advantage plans are graded each year on a star rating system, 5 stars being the highest and 1 being the lowest. The higher the ratings are, the more money the Advantage plan gets to manage your healthcare. So that's usually a good thing because then that means typically there's better access to healthcare, better response time if there's a prior authorization required. So not all Advantage plans are created equal. There's good ones, there's not such good ones, there's okay ones. But I do think people who have a lot of disdain for Medicare Advantage, I think it can harm people. And I'll just give a quick example before this presentation ends. I had a client, actually an RSS member, who was very against Medicare Advantage. She was on a fixed income and was paying roughly $800 every 3 months for her Medigap plan. I saw that she in fact qualified for Medicaid, right? And due to that, she did not need to be on that Medigap plan. On a very fixed income, she was able to go on to an Advantage plan that has very little copays and gives her extra benefits. When all was said and done, when I crunched the numbers and saw, it was saving her. She saved herself roughly almost $10,000 a year by getting rid of that Medigap policy, right? Getting on a plan that coordinates her Medicare and her Medicaid benefits and getting some additional benefits because she's on a fixed income and all her doctors participated. So again, you know, it just depends on the person, right?
Caitlin,
Medicare Advantage may not work for someone with a lot of issues.
Right, Caitlin, can I just speak as
Yep.
somebody who uses Caitlin, because I went on Medicare a year ago, and work with Caitlin. I think what you're also hearing is all of these are very individual decisions. And that's why I think it's really helpful to talk to somebody like Caitlin or someone else who can really work with you to go through all of these different policies, because it really, everyone's medical situation is different.
Yeah.
And you really need to look at your own personal situation.
All right, we want to
Absolutely. So-
thank you, Caitlin. Again, she is available one-on-one and it is a free service. She has so much information. Welcome. And she's going to find you the best plan. She's not siding with any insurance. It's whatever works for you. So please give her a call. I gave out your cards. Caitlin, you'll be busy.
Okay,
Thank you.
All righty.
Wonderful.
I'm gonna close things down then.
All righty, thanks.
Okay.
Have a good one.
Take care. Bye, everybody.
Bye. Thank you.